Many gastrointestinal disease may involve some kind of dysbiosis, which is by definition a disequilibrium of your intestinal microbiota with different bacteria and different functions. So the most frequent disease is what we call irritable bowel syndrome. It's a very frequent situation affecting more women than men, young women usually, and they complain of abdominal pain, bloating, intestinal transit disturbances, so they suffer a lot. And usually when you perform examination, you don't see any abnormalities in their intestine, except some intestinal hypersensitivity and also a dysbiosis. So in the last year, we have discovered that and tried to work on modifying the microbiota, especially with pharmabiotics, to try to improve the situation. That's the most frequent disease. And now, of course, you have a lot of other gastrointestinal diseases which involve the microbiota, probably colon cancer, and this may lead progressively to diagnostic tools of colon cancer risk. Some colleagues work on that. Very impressive data. Also inflammatory bowel disease, so Crohn's disease, ulcerative colitis, and in fact probably all the gastrointestinal disease when you have diarrhea or constipation, they change the ecology in your intestine and may involve so dysbiosis. So is the dysbiosis in those situations the cause or the consequence of the disease? Nobody knows, but we can use that as a tool to make better diagnosis or as a target for treatment, especially with pharmabiotics.